use the podium mic.
Hospital overview?
Yeah.
That's all?
Yep. Am I teed up? Cool. All right. All right, everybody more oxygenated? Excellent. All right. So I know for a non-lecture-based curriculum, we're telling you a lot of stuff in a lecture-type format. But this is the last one, for the most part, sort of. So we'll do some more interactive IQ stuff. Now that Dr. Haney got you all set up, I'm going to tell you a little bit about our hospital affiliates, and then we'll move on to IQ. So when, on the interview day, we talk a lot about the clinical resources that are available to all of you. And I don't think I'm exaggerating when I say we probably have the most robust clinical experiences that a medical school has to offer in the country. Because really, with our 4 hospital systems, you have the ability to virtually see anything, to experience anything that you could potentially see out in clinical practice, or explore virtually every angle of medicine that could particularly be of interest to you. So obviously, when you interviewed at the school, we could only take you over to Case Medical Center, University Hospital, so it was geographically adjacent. But I think it's important to spend a little bit of time giving you a little bit of insight into all of the 4 systems, because you'll have the opportunity to rotate through all of those equally. So first off, and in no particular order, is the Lewis Stokes VA. The VA is just down the street, and I'll kind of give you my little anecdotes and my experiences with each system as we move forward, too. So the mission of the Lewis Stokes VA is to provide high-quality, technologically current healthcare services in a compassionate, humanitarian, and ethical manner with a multi-centered environment which promotes strong research and educational programs in affiliation with Case Western Reserve School of Medicine. So the VA does all of that, and as you'll see in the next few slides, I'll sort of show you how they really do accomplish all of the tenets of their mission. So first off, our VA is the largest in the state. It's the 3rd largest in the United States. Tremendous patient volume, lots of national recognition. It's a huge system. The VA has 13 community outpatient clinics and serves 24 counties in northeastern Ohio. Again, huge patient population, close to 150,000 vets enrolled annually, 11,000 admissions, over almost 2 million outpatient visits, and almost 5,000 employees at the medical center. So really a very tremendous resource for us here in the city of Cleveland, and certainly even more importantly for our vets. Lots of accolades. It's a very well-accomplished VA. You know, the VA kind of didn't have a great reputation in the 70s, 80s, and early 90s, but it's really turned over. A lot of young aggressive doctors are going to the VA. They're very committed to the care of the vets. There's a lot of great research that's going on. My husband's a vascular surgeon at the VA, and I used to go there 1 day a week before I came over to work at the medical school. It's really a very remarkable place to be, and the vets are a very remarkable population of patients with whom to work. Lots of accolades, very cutting-edge work goes on at our VA. It's the first VA to receive disease-specific accreditation for inpatient diabetes care. And diabetes is very rampant in our older veteran population, like the World War II vets and even the Vietnam vets now. Special commendation by VA. Our VA received special commendation by the American College of Surgeons because of their high performance indices. That's my husband, yay. VA has more clinical research. Our VA has more clinical research and education programs of excellence than any of the other VAs. All of which were named by the Undersecretary of Health. I won't mention all of them, but some of the really more relevant ones are mental issues, health care for the homeless. So we have a domicile care for homeless veterans, so it's kind of like apartments, lodging for homeless vets, where we can give them some rehabilitation services until they can get out to a higher level of function. Very robust spinal cord injury unit with some great research going on, some very collaborative programs going on. If you look a couple lines down, we have a functional electrical STEM program and an advanced platform technology center of excellence. So there was just a big meeting here in Cleveland for the APT on Friday. And some really remarkable things that go on with the FES Center. One of the things that the F Center is working on doing is helping paraplegic patients walk by implanting electrodes in their extremities. One of our surgeons at UH was doing a lot with diaphragmatic innervation in quadriplegic patients. Who worked on Christopher Reeve, if you remember him, Superman, to try and enable him to breathe independently. So one of the coolest stories I think out of the FES is I had a big birthday party for my husband a couple years ago, and he works with the FES Center, and they'd implanted electrodes in a 22-year-old patient who'd been shot in the back. He was a paraplegic, and he came to my husband's party, and he stood up and he danced for 30 seconds for the first time in 7 years. So I thought that was really just an amazing translation of what we do every day to how it's really manifested in real life. So one of the mission tenets of the VA is technology, and the EMR at the VA is the best EMR, most robust, most fully fleshed out that you could see anywhere. If a patient comes to the VA from Little Rock, Arkansas, you can log on and look at their labs and their x-rays and read their notes, their radiographic studies, so there's not duplication and there's a lot of continuity. So the EMR is probably the most robust one that you'll see anywhere. The VA and its EMR is being held up as a potential model for future healthcare reform, so it's a good place to be. Next off, of course, we have the Cleveland Clinic, where we were last night and where your hotel is geographically located. It's a huge center. It even has its own zip code. So got the U.S. Postal Service to acknowledge their hugeness. So very big place. So it's a major academic medical center that provides kind of the triple threat. In academic medicine, we talk about the triple threat. It's patient care, teaching, and research, and the Cleveland Clinic ably and very admirably pulls off that triple threat of very robust patient care, research, and education. About 3,000 staff physicians, almost 5 million patient visits a year, and a very diverse case mix, certainly to be seen at the Cleveland Clinic Foundation. Lots of highlights. I won't go through them all because I'd be here till next Tuesday going through all the highlights, of course. But one of the really interesting things is it's one of the world's first nonprofit group practices that was administered and run by physicians. And to this day, that model still holds true. The CEO is a cardiothoracic surgeon. So it's really very interesting that the administrative structure there is mainly comprised of physicians. So a lot of good insight into what needs to be done and what some of the issues are that need to be addressed. Obviously, as you probably saw when you were driving up and down Carnegie with all the banners on the light poles, is that Cleveland Clinic is consistently ranked #1 nationally by U.S. News & World Report in cardiovascular care, and I think #3 overall for care in general. It's a huge institution with a really good focus on quality outcomes data, one of the national leaders, and looking at quality outcomes data to help both patients and physicians make more informed treatment decisions. Very large research arm at the Lerner Institute, where our Cleveland Clinic Lerner College of Medicine, our sister programs, house. It's a 650,000 square foot research institute with lab-based, translational, and clinical biomedical research, so very robust research facilities there. It's got one of the largest physician graduate training programs, tons and tons of residents and tons of fellows. Very innovative with industry. The Cleveland Clinic spun off 48 companies and has been recognized as one of the world's top 5 corporate venture organizations in healthcare, which is kind of cool. Again, too many medical breakthroughs to go through. We'll be here till next Thursday if I try to go through all of them. But some of the more key ones to some of their missions are first coronary angiogram, first CABG in 1967, first minimally invasive aortic valve surgery, ranging to what you may have read in the news just a few years ago, the nation's first near total face transplant. So really some very remarkable things going on at the Cleveland Clinic Foundation. Again, we have a very large local presence, and then we have a very large national and international presence at the Cleveland Clinic. We have the main campus, 8 community regional hospitals, lots of family health centers. There's the Cleveland Clinic in Florida, in Weston and Palm Beach. There's a fairly newly opened brain health center in Nevada. There's a Cleveland Clinic Toronto. And there's a Cleveland Clinic Abu Dhabi opening in 2013. I don't know if we figured out how to get you guys over there for rotations or not yet, but I'm sure some of you will be creative enough to figure out ways to get over there. So next up, we have University Hospital's Case Medical Center. I think you guys saw a little bit of it on your interview day. It's right across the street. It's the hospital that's physically attached to the medical school. It's also the primary clinical affiliate of Case Western Reserve. That doesn't have a lot of ramification for you guys. It's more of a fiscal relationship and sort of a titular relationship. You guys will have the ability to rotate in any and all of our institutions equally. So you definitely will be able to take advantage of the full gamut of experiences that we have to offer. So the mission of UH is to heal, to teach, and discover. That's where I spend my clinical time down in the, I so affectionately call it the dungeon of radiology. We have UH, the Case Medical Center, of course, is the main thing. We have Rainbow Babies and Children's Hospital, which is a very highly ranked pediatric program nationally. We have a lot of our case med students that wind up going into pediatrics because they have such a great experience there at RBNC. We have a very relatively newly, I think it's just a year-old, opened cancer center, which if you saw that large glass and steel edifice that's kind of out on Euclid Avenue attached to University Hospitals Cleveland, it's beautiful inside, and I just had lunch at the Wolfgang Puck restaurant in there on Friday. It was really good. So that's good. It's part of the NCI designated Case Comprehensive Cancer Center. So it's like a multi-institutional cancer initiative with Case Western Reserve, Cleveland Clinic, and University Hospitals of Cleveland working together collaboratively. We also have a hospital within the hospital. We have Mac Women's House, which is the only hospital in Ohio that's dedicated solely to women, so large number of deliveries. We have a large gynecologic oncology program here as well. We too, we, they, us, all of us, we're all one big happy family, right? So University Hospitals also is like the Cleveland Clinic in that we have our large main campus, and then we have a fairly large geographic outreach with 6 community hospitals, 2 joint venture community hospitals, lots of outpatient centers, and almost 4,000 docs. So the reason I put in the number of docs in all of these slides is to give you an idea of what your resources are. You will not be climbing all over each other to get in for a clinical shadowing experience. You will not be climbing all over each other to get into a clinical or a basic science or a translational research experience. The world is kind of your oyster because we have so many faculty here who are waiting and eager to work with all of you. So lots of good rankings for university hospitals, lots of accolades, top 10 by Reuters, top 5 in the University Health Systems Consortium, top 3% in U.S. News and World Report. Lots of progress. We had a Vision 2010 program where we had lots and lots of new construction going on. We had a $1.2 billion investment. One of the major projects, as I said, was the Seidemann Cancer Center, which is just that beautiful building just across the street. It's a 150-bed cancer center, and the beauty of that is we have imaging in there, we have laboratories in there, we have ORs in there. So our sick cancer patients aren't being shuttled all across the hospital, and they're huge systems. So they're not starting out over here in imaging, and then they're being transported 22 minutes across over to the ORs. Everything is there, physically located in the cancer center. So it's a very comprehensive care for our patients, and all of the referrings are over in the same area too, so it's really easy for somebody to just curbside somebody else. So it's really helped to streamline care, I think. We have a new ER that opened in July 2011. It's absolutely beautiful. Christian says it kind of looks like, the pediatric side looks like the Pottery Barn for kids in a good way. So it does. It's really a beautiful ER. There's an adult ER. There's an urgent care, well, sort of like a walk-in, and then there's the pediatric center. And it's really helped to also streamline care. It's so big. We were talking to one of the ER docs who wore a pedometer on her first week on the job, and she was averaging like 4 to 6 miles a day, which she said was great because she could eat more brownies at the end of the day, so that was good. So we have a brand new NICU. The NICU similarly has some ORs there and some imaging there as well, so our very sick youngest patients don't have to be transported all across the hospital. We're able to sort of do all of what we need to do in one geographic area. We have a brand new, beautiful community hospital that's very close to my house, Ahuja Medical Center, that's got a great new health and wellness center. And the woman who's heading it up, Dr. Adan, is a psychiatrist who's very interested in meditation and alternative therapies. So really some very interesting work is going to come out of there, and some very interesting resources for our patients are going to result, I think. Okay, next up is Metro Health Medical Center on the west side of Cleveland. It's an academic healthcare system committed to our communities by saving lives, restoring health, promoting wellness, and providing outstanding lifelong care accessible to all. Metro is our community, our county hospital. It's a public safety net for our patients who don't have the ability to pay, but patients who do have the ability to pay also go there because it's certainly a tertiary care center that delivers very high-level care as well as has very robust research programs. It's the only level 1 adult and pediatric trauma center, well, it's the only hospital in Ohio that has both adult and pediatric trauma level 1. We've got Cleveland's only burn center, humongous, very busy ER, lots of surgical procedures. Metro Life Flight, you can see the yellow helicopter down there at the bottom, is one of the few remaining physician-staffed helicopter services in the country, so very big presence regionally. The Metro is very well entrenched in our community. They're currently celebrating their 175th anniversary of caring for the community. We have a very extensive network at Metro. We have 17 health centers located throughout Geauga County, in addition, of course, to the flagship main health center, which is Metro Health Medical Center proper. Very diverse array of multi-specialty health clinics. We have an LGBT Pride clinic with which our students are extremely active. We have an Asia Town Health Center, which some of our students are active with as well, acting as translators and helping to do exams on the weekends. Outpatient Surgery Center, there's a large HIV, tuberculosis, bless you, infectious disease clinic at Metro. So, I can multitask. So, lots of stuff, really good stuff going at Metro. I mentioned the FES Center, and it's really very remarkable to me some of the outcomes that we've been able to accomplish through the FES Center. We also have the region's largest team of certified geriatricians. Obviously, we have a rapidly aging population, and geriatric medicine is really a very burgeoning area. So, lots of awards in our Senior Health and Wellness Center at Metro Health. For our trauma patients, once they get injured, we fix them up and then we put them back together and we help to rehabilitate them. Metro has the largest rehab institute in Ohio, so really a very interesting array of services at Metro Health. But not only is the clinical area very strong, but there's a lot of research going on. Metro gained $34 million in grants, contracts, and clinical trials last year. Lots of research centers, many of which are very closely intertwined with Case Western Reserve. The Center for the Reduction of Healthcare Disparities is exactly what it sounds like. A lot of our students get extremely involved with that center, with elective summer programs, or even with a 4-month research block. Heart and Vascular Research Center, there's a Kidney Disease Research Center, Cancer Care Center, large perinatal reproductive health network there as well. So a few of the highlights that aren't necessarily hospital-based, but are very accessible and to some degree run by our medical students. Dean Davis alluded to this earlier, is the Free Clinic of Greater Cleveland. It's the second oldest free clinic in America. I think the first is in Berkeley. Anyone correct me if I'm wrong? Anyone know that? No, I think the first is in Berkeley. So we're the second oldest free clinic in America. We're one of the few free clinics that has dental services. Access to dental care is a very significant problem for patients who are underinsured. So our dental services are very well utilized. Very large patient volume, almost 11,000 patients a year cycle through the free clinic. All of the proceeds from our Doc Opera go to support the free clinic. And at last count, the Doc Opera profits were $18,000 from one show. So we have a very close relationship. And so as Dean Davis alluded to this morning, we have a student-run free clinic that meets every other Saturday. Our students provide acute care, not chronic care issues, but acute care. So if you have a sore throat or an earache or something like that, you go in, you're seen, you're evaluated, and you're even given your medication. So it's a very nice resource for our local community. Interdisciplinary practice is sort of a buzz term right now in medicine, and the interdisciplinary program there is done in conjunction with the School of Medicine. So we're kind of leading there in that we're already on that page. So I like to go through this because I really want to underscore to you that you can have our students have an unbelievably well-rounded, comprehensive clinical experience. The world is your oyster. Clinicians love to work with you guys, partly because